series Symposium entitled Back to the Buffet, Food Safety in a Post-COVID World. Okay, post-COVID world, perhaps not. When we were setting up and brainstorming topics for this presentation several months ago, we thought, okay, by November, maybe we will be post-COVID, but clearly we are not, but it was too late to change the title. So it's still Back to the Buffet, Food Safety in a Post-COVID-19 World. Thank you for joining us. My name is Paul Medeiros. I am co-moderator for today's session, together with my colleague and partner in crime, Michelle Martin. Our symposium format this year is 4 sessions. The first 2 were held earlier, November 3rd and 10th. This is the 3rd, and the 4th one that we hope to see you all back at will be November the 24th. So, who is the Guelph Food Safety Seminar Series, folks? GFSS for short. Well, this group and our annual symposium began in 2004 to provide a forum in which to share timely and pertinent food safety topics. GFSS is a partnership in agri-food safety, which includes several partners, which you see here, including the University of Guelph, which is CRIFS, as well as the Department of Food Science, Agriculture and Agri-Food Canada, CFIA, the Canadian Institute of Public Health Inspectors, the Ontario branch, the Public Health Agency of Canada, Health Canada, NSF International, and the Ontario Ministry of Agricultural, Food and Rural Affairs. And as I mentioned, we are thrilled to present today's session 3, Takeaways from Takeout, How We Interact with Food Post-COVID-19. And take it from someone who does a lot of interacting with food. Myself, COVID-19 has definitely changed things up for me. I'm sure our 2 presentations will resonate with all of you, both professionally and personally as well. Okay, so Michelle Martin and I are co-moderators for today's session. When I am not moderating sessions, my day job is with NSF International, where I am the global program lead for new program development and services within NSF. And when not working very hard to make up for my poor moderator skills, Michelle does important work as manager of Durham Region Public Health. Before we get started, however, we're going to run through some housekeeping items. Okay, there will be 2 presentations held this morning. There'll be an opportunity for 1 to 2 quick questions following the first presentation, but the presenter, Stephen Glass, will remain on to the very end, where there'll be an opportunity for additional questions as well. Because this is virtual, I will assume that wherever you all are, you know where your bathrooms are and you know where your emergency exits are. So we're not going to go into that. But please do ensure your cameras remain off and keep yourselves muted. There will be an opportunity for you to, at any time it occurs to you, so you don't forget, put a question down in the chat box as well, because we will be monitoring those, as I said earlier, giving you an opportunity for us to respond to those questions. Recording, yes. So the program will be recorded, and if you want a copy of today's presentation, and it's funny, I still use that term, if you want a copy, because I refer to the old school way of having actual copies. If you want an electronic file of the presentation, just email Susan Sabatini, and she will be very happy to get that to you. Okay, so we are thrilled to have Stephen Glass, Director of Global Food Safety, JustEatsTakeaway.com, as our first presenter. His topic is food delivery, maintaining food safety in a pandemic. Stephen started his career in Edinburgh, Scotland, where he qualified as an environmental health officer in 2004. After working for 10 years in public service in both Scotland and London, Stephen moved into the private sector, working in both safety and operations for several hospitality brands in the UK and Europe. Since 2020, Stephen has been Director of Global Food Safety for JustEatTakeaway.com. We are very happy to have Stephen on the call, and I'm going to pass it over to him to start his presentation.
Thanks very much, Paul. I'm just about to share screen. I hope you all can see that, and thank you so much for the warm introduction. As you know, I don't need to introduce myself again, obviously, but I think it's worth mentioning at the beginning that anytime I present, it comes with a caveat of me having a very heavy Scottish accent. So if there's any questions, anything you don't understand, then by all means send it in writing and I can probably answer it a bit clearer, but you'll hopefully get used to that. So yeah, I'm the Global Food Safety Director for JustEatTakeaway.com. My presentation is about maintaining food safety throughout the pandemic and after the pandemic, what happened throughout it and what we learned from it, and really what the industry learned from it. Throughout my presentation, I'll talk about us and JustEatTakeaway.com, and I'll explain who we are for those who are unfamiliar in a second or two. But really, you can read into that what happened in the food delivery industry. So the web aggregators such as us and Uber Eats and DoorDash, by and large, operate in the same way and by and large face the same threats, really. So the presentation is in 4 parts. The first is really talking about who we are, and I'll go through that quite quickly just to familiarise those who may be unfamiliar. The second part's about what happened, which will be very familiar to a lot of people, obviously, because it was a global pandemic. The third part is how we responded to that, and the fourth is really some of those trends that we spotted during the pandemic that we don't see going away, really. So who are we? Well, JustEatTakeaway.com, we call ourselves JET, and we are a leading global online food delivery marketplace. That's a mouthful, but essentially what that means is we operate much like Uber Eats, much like DoorDash. We deliver food from restaurants to customers using an online ordering function. We're a huge company, and we are globally the biggest. There are some companies that operate wholly in China that are bigger than us because of the size of the market there, but in terms of a global player, we're vast, really, and we operate in 25 different countries. We've got circa 600 million orders per year and 100 million customers. So the marketplace for us is huge, and those 100 million customers, that's customers that we have accounts for. We can also tally the guests that don't keep accounts with us, and you get a significantly higher number, really. But those numbers are growing every year because our company is expanding and the food delivery service is expanding as well. But you might think, well, you know, you may not have heard of JustEatTakeaway.com, and you might take sort of issue with the claim that we're the world's biggest. Well, the reason for that is that we don't operate as JustEatTakeaway.com. We operate as national brands, and this slide just shows you what those brands are. In the US, we are Grubhub. In the UK, we're Just Eat. Lieferando in Germany, Toys Bizard in the Netherlands, and of course Skip the Dishes here in Canada. Those 5 brands that you see at the top are the 5 most important markets to us as well. So it gives a flavour of where we operate, but as you can see from the others, we operate more or less the same thing in places as far away as New Zealand and Israel, really. So we've got a big presence in Europe and a big presence in North America as well. And last slide on who we are, before I get into what I'm here to talk about, really. This, for those unfamiliar with food ordering, and I know that during the pandemic, many people became familiar with it, but this slide sums it up as easily as we can, really, exactly what we do. There are two journeys here. On the left-hand side, you will see the customer journey. On the right-hand side, you will see the restaurant journey. The customer searches for food, orders it, and then eats it. And the restaurant receives that order, cooks that food, and arranges the delivery for it. Inside that circle, you can see the transfer of both money and data, really, between the consumers and the restaurants. And we're at the centre of that, controlling it, essentially. So that's how we operate. That's how every food delivery platform operates. And what we do day in, day out may differ from place to place. How we employ drivers may differ from company to company, but by and large, that's the market and that's how it operates, really. So moving on to section 2, which is what happened in 2020. And obviously what I mean by that is what happened during the coronavirus or COVID pandemic. And this timeline shouldn't surprise anyone, because it was more or less the same, albeit with a month or so delay between Asia to Europe, and then another couple of weeks between Europe and North America. But ultimately, this is what happened within our business and within our industry. From February onwards, we started receiving lockdown restrictions that affected many of our restaurant partners. In fact, the vast majority of our restaurant partners. Now, just to explain that term, a restaurant partner is a restaurant who has signed up with our service to fulfill orders through our service. We don't own any of them. We're in partnership with them. We provide a marketplace and a vehicle for that food to get to the customer. So whilst we weren't directly affected by those lockdowns, many of our partners, and by that being honest, a lot of our income stream was affected. And it led to immediate closures, as everyone knows, in vast swathes of the world. The dine-in sector collapsed. It had to close overnight.
Stephen, you were muted inadvertently.
I'm sorry, is that better?
Yes, thank you.
Sorry, I don't know when I was muted from, but
about 5 seconds.
Okay, perfect. Okay, so we had many dine-in partners who were offline, and many others who were affected as well. Come March, we saw a cliff drop in our order volumes. 27% is a conservative figure for how many restaurant partners went offline, but it was a significant amount, which led to a near immediate collapse in the orders through our platform. However, given that we operate in the in-home market and not out of home, we saw an immediate bounce back. In the next slide, I'll show you exactly what that looked like in terms of order volume. And as a result, by spring of 2020, our volumes had grown, our order volumes in every market in which we operated had grown significantly from where they were pre-pandemic. And we obviously saw that initially as a good thing, but really almost immediately began to see the strain on our restaurant partners. And as a result, as a global organisation and as our national organisations began to spring into action and offer support for those restaurant partners. So that's why this Spring 2020 is circled. I'll explain exactly what support we gave in a few slides time. But really just to complete this journey, in autumn, winter, dependent on where you were in the world, obviously, dine-in restaurants began to reopen. It was more a summer thing in 2020 in Europe, but we saw even more restaurants come back online, and as a result, more capacity requirements in our system. And lastly, going into 2021 and unfortunately into 2022 as well, we will see restrictions lifted but put back in place. But as a result, we have high order numbers. But the surprising thing, and the thing I want to extrapolate on during this presentation, is that the order numbers don't drop when restrictions are lifted. And that's something we've saw across our industry in food delivery. It indicates a deeper behaviour change than we would expect from a temporary lockdown, and I'll explain that in a bit more detail later on. So, moving on to the next slide, if I can. So this graph explains exactly what happened to those order volumes. I've removed the figures from order volume for, commercial sensitivity, but that is a real graph of the actual numbers that happened in one half of our business around the March 2020 time and throughout the rest of 2020. We saw an immediate drop followed by a near instantaneous bounce back, and then a doubling of our business, and then a trebling of our business in some markets, and that's continued to grow. And if you can see where July to September hits, yeah, it levels off somewhat. It certainly doesn't plateau. That's when many businesses were reopening, and if you look at the end of it, during the winter period in the Northern Hemisphere, which is the traditional growth period for our industry, it began to climb again, and that hasn't stopped really. Certainly the growth has slowed, but the growth continues, and that, to me at least, and to our business analysts, indicates that a lot of that growth is here to stay, and that's both a good and a bad thing. But just for illustrative purposes, we in the UK, our orders grew by 76%. In Canada, through Skip the Dishes, it was 72%. That's from April to September 2020. In Netherlands, as I mentioned at the beginning, it's where we're headquartered, it's where our original business was, and it's one of our most important markets, and it grew by almost a half in the same period, really. So yeah, that illustrates what happened. Now I'll explain exactly what we did, and how we stepped in to alleviate some of those pressures that were happening in our restaurant partner estates, and how we hopefully helped and will continue to help, really. Before I do that, let's sum up. Order volumes explode. Good news, you would think. Commercially for us, of course, it's good news. We only have an income stream through delivering food from restaurants to customers. As a result, the more of that happens, theoretically, the more money we make and the more money companies like us make. It's a very difficult time to talk about business success when so many businesses in the food industry are struggling. But the food delivery sector and the web aggregators were one of those success stories that happened through 2020. And you think, yeah, that's good news, but I'm a safety professional, and as a result, probably a natural cynic. So I immediately started thinking, right, what's the catch here? And as a business, we identified three of them. The first is the obvious one. Many of our restaurant partners closed. Many of them, unfortunately, would never reopen, or never reopen to the same capacity that they had in the past. As a result, we had far fewer choices for our customers to make, and far less appeal for our customers. So it made sense for us to try and support those businesses that traditionally didn't operate in the delivery space, and allow them to adapt and give them the tools to adapt and move into that space. Secondly, again, kind of obviously for us, is a capacity issue. We deal with surges in demand every weekend, but this was next level. So could we actually step up to a doubling of business or a trebling of business? And I'll explain kind of what we did to meet that. Next slide. And the third one, the important one for long-term planning, is what happens when we go back to normal. You know, it's great news when a business booms and when there is, you know, a huge amount more orders and capacity for that business. But this was a strange event because we knew it would come to an end. So that's a difficult one to plan for. Do you onboard a huge amount of staff and a huge amount of technical know-how only to then let it go again in a year's time? Difficult choices that we had to make, really. And that one still is as yet unanswered, because we don't really know when things are going to go back to normal. So this is the third part, and probably the part I'll spend most time on. And I've really got 2 slides here, and forgive me for how many words are in these slides. I'm a great believer in talking to the slides rather than writing everything down, but it lent itself to being a bit more verbose here, so forgive the amount of words, but yeah, it does explain, you know, what we did. And I've got 2 slides. They look kind of similar. One is about how we actually changed as a business to manage the increase in demand. So what we did in terms of our operations. The second slide is more specific about safety and food safety specifically, and what we did in that area and that sphere. And then I'll sum it up in the third slide about those safety controls. But this slide really is to answer the problem that I posed in the previous slide about what do we do when we have got an unprecedented demand for our service. Well, the first is we invest in logistics, and we used the pattern that I'd mentioned previously that we've always had in place. People order food at very specific times of day. We've always known that. You could look at our traffic in any major market that we operate in at 11:25 a.m. and near no one is ordering. Close to zero people are ordering. As soon as it passes 11:30, people begin to think about lunch, and it skyrockets. So we've always been able to meet that demand. And really, when it came to meeting the demands of the pandemic and the huge amount more restaurants that would want to move into the delivery space, then it was really just about scaling that demand. So those peaks that we get at lunchtime, at dinner time, at weekends, major holidays, that's how we based our sort of full-time response, really. It wasn't easy, and there were major teething issues with this, but it meant that we had the pattern and the template really to scale up. We obviously, it goes without saying, started a massive program of driver recruitment. Now, without going into too much detail, we differ globally, I should say, to some of our big competitors, because we actually employ a lot of our drivers. Not yet in Canada or anywhere in North America, but in Europe it's the predominant model. So we don't have self-employed contractors delivering for us in the main. They still make up a significant proportion of it, even in Europe. But the majority of our deliveries in Europe are now done by employed drivers, fully employed by us. That gave us a lot more control because we could switch that tap on and bring people in. And thankfully for us, unfortunately for economies everywhere, a lot of people were finding themselves out of work. So we were able to get that done fairly seamlessly, and thankfully retain a lot of those drivers as well. And lastly, we entered into a huge scheme of customer support. We had some, forgive me, my dog's just walked into the room, so if she starts barking, I'll kick her back out. We had invested in customer service support. So we've got country-based customer service teams everywhere. In every country that we operate in, and we scaled those up. That was the slowest part, and that's where we had the main sort of pain point in our operation as we moved through the pandemic, really. Next slide, as I said, is about what we did specifically about safety. And again, forgive the amount of words, but I think it lends itself to a bit of explanation. The first thing and the most obvious thing we put in place was contact-free deliveries. At the beginning of a lot of the quarantine periods and lockdown periods, many people were still fearful, very fearful of the pandemic and how it spread, to the point where we had concerns both from our customers and also from our drivers about how we interact at the doorstep. So we immediately put in place a contact-free delivery service. Now, it's not perfect because these things can't be. It relies on some compromises in terms of putting, carrying boxes on the ground, allowing people to come out and get it, and it adds time to the delivery. So it's a bit clunky, but it's necessary, really, and that remains in place. It's not a tier 2 for people who use the service. You'll quite often see that we have drivers who still deliver in this exactly the same way as they always have. But the prompts have been out there, and if a customer prompts at the point of order that they want a contact-free delivery, then endeavour to deliver it in such a way. The second, as Paul will know, is that we invested heavily in support through our global food safety partner, which is NSF. We already had a programme of food safety training and audit support for many of our restaurant partners in our biggest markets, and we switched that overnight. Really, we switched it from in-person audit support to COVID support. So we provided COVID-specific training. We switched the licenses from food safety to COVID. We provided COVID support visits if necessary, coaching calls and materials for our restaurants, all free of charge. We pick up the tab for all of that support provided through NSF. And lastly, much like the customer service teams that we had in the operations slide, we have compliance teams in most of our large markets, and these compliance teams really deal with customer complaints and deal with regulators who may want to interact with us. And we provided support to them, provided training to them, but we also briefed them on all of the changes that were happening daily, almost in every jurisdiction that we operated in. And I use the term jurisdiction because obviously in Canada you're used to the fact that you've got provinces and territories. In the UK, there's the different nations. Each area was operating somewhat differently to others, so it was a full-time operation to keep on top of that, to route that information and the changes to that information through our compliance teams and ultimately to our drivers and riders so that they could deliver safely and within the law, really, and to make sure that our restaurant partners were updated about each change that would affect their area, really. So summarising that and adding a couple of points as well, this is really the sum of what we did for our restaurant partners, but ultimately what we're continuing to do for our restaurant partners, because as mentioned really at the beginning of the symposium, we're not through the pandemic yet. It will be some time before we get back to anything that resembles normal, and we've saw some changes in behaviour, which means that many restaurant partners who probably had delivery as an add-on, they really were dine-in specialists. They have saw the potential in delivery, but need the support to switch that on fully. So these 5 points won't go away. And just running through them, I've mentioned that the expert advice that we give them, we've got a global food safety team. We rely heavily on NSF for updates at a national level and some strategic advice. But we've also got various different legal teams across our company. All of us are risk scanning, forgive the jargon, to look at what's changing, what advice is best given to our restaurant partners, and how do we best deliver that. Secondly, PPE. It was protective equipment was a massive issue at the beginning of the pandemic. We had purchasing power because we are a huge multinational company. So we were able to step in, buy it and provide it either at cost or free of charge to a lot of our people, particularly in the UK. This was a critical issue. Restaurants couldn't get open because they didn't have masks and didn't have gloves. We were able to do that for them. I mentioned the training that we've also provided and the free materials. By materials, I mean social distancing posters, COVID aware posters, various other pieces of kit and signage that we provide to the restaurants. But most importantly, really, is the money. And what we did, not everywhere, I should stress, and there has been some criticism of this in many areas of the press, but ultimately we provided commission-free sales. So we make our money by charging a commission to the restaurants. We switched that off for most restaurants that had never been in delivery before. So a traditional dine-in restaurant that hadn't worked in delivery, if they wanted to come onto our platforms in the UK and Canada and various other countries, we would switch off commission for a period of time so that they could make money at it and establish a working pattern in order to make it work for them, and being commercially minded, work for us in the long run as well, really. But it did deliver, and it delivered a lot of savings across the board, albeit they're minuscule when you consider how much was lost during the pandemic in the dine-in sector. But being honest, there's obviously things we couldn't do. And again, I speak for the sector rather than just for my company. One of the big losers really during the pandemic, at least for us in the delivery market, was carbon footprint. Now our footprint, as it says there, is actually lower than you would expect. That's because the vast amount of our deliveries in Europe, at least, are done through e-bikes or through traditional pedal bikes. So we don't actually have petrol or diesel-driven vehicles going everywhere as you may expect. But we still have a lot, and as a result, we've got a carbon footprint to consider. The main issue for us is packaging, because we are delivering food for sometimes 2 meals a day to every single house that might have an account with us. The packaging mounts up, and people were concerned about hygiene and concerned about food safety. Therefore, the trends that we saw, say in 2018 and 2019, of moving to, smaller packaging, less bulky, perhaps some bio packaging, all of that seemed to pause as people wanted to fall back on what they felt comfortable with, which unfortunately in the main was single-use plastics. We couldn't provide an equivalent revenue stream. We could support restaurants that were in the dine-in space beforehand, but we couldn't replace what they did. But we hopefully kept many of them afloat. And we couldn't, and I speak personally in this front as someone who likes dining out and likes spending time socially with friends and family, we couldn't give them what they missed. We could give them the food, but not the experience. But that probably segues into what I think is my last slide, which is what comes next. And this is really the trend spotting part that I wanted to mention at the end. We've spotted this as a business, that these 5 things are big and aren't going away. I mentioned at the beginning and probably throughout that delivery is here to stay. the numbers aren't coming down. In many parts of Europe, it's beginning to change now, but many parts of Europe throughout the whole of 2021, from really early spring onwards, we had next to no COVID restrictions, and from the summer onwards, we had next to no travel restrictions. Yet our delivery numbers kept climbing. So people have learned it as a behaviour and will use it more as that continues. The other thing, again, forgive the sort of marketing speak, but we talk about moments and not meals anymore, because and that's reflective of the behaviour that we saw. We never led this. This changed and we adapted to it. People order coffees at mid-morning now. They order cake or dessert for after dinner on its own. They might order some alcohol at the weekend with next to no food. Those things were really rare in the food delivery space beforehand, but they're growing and growing now across all of the aggregators. Safety, thankfully, from speaking selfishly, from my point of view, is now a principal concern. We can track our customer complaints, we track our social media mentions, and the segment that's dedicated to people either concerned about safety or making suggestions about safety has skyrocketed, and that's unlikely to dip, really. And it's not just about COVID safety. People are worried about allergens, they're worried about general food hygiene, as well as rider safety as well. People want a wider diversity of food. That existed before the pandemic, but it's established itself throughout, and people definitely want more than just the established restaurants and mainstays that they've got. And I mentioned the previous slide, it's coming back. COP26 just happened in my home city, even though I don't live there anymore, in Glasgow. It's a massive issue. It's the biggest issue that the planet is facing, and every single major organisation, every organisation anywhere, is being scrutinised about what they do. We know that we do well in terms of e-bikes. We don't do well in terms of packaging. So we, and again, I speak of the industry, have to change that and adapt. I'll just push my dog away. And yeah, that's really it in terms of what happens in the industry. What happens next in safety, and I'll run through this because I think I might have went over time, so apologies if I have. Our support package isn't going away either. We have switched this from response to business as usual. Heavily discounted HACCP software we provide in many of our markets to the restaurant partners. Sometimes we give it for free, so that we can make sure that they are compliant when they have a food inspector or environmental health officer call, because that's in our interest. We give registration and enforcement assistance, most of that done through NSF, to make sure that we meet our existing minimum standards for restaurant partners, but those minimum standards we have a plan to increase. So we're going to take them with us, essentially. And because we have to, because they're the mainstay of our income streams, really. And as I mentioned a few slides ago, we've got a dedicated global food safety team that I head up that helps in those day-to-day inquiries. We interact with our restaurant partners, as well as our customers and regulators, and really everybody in between, to make sure that we're accountable for the part of the delivery that we are responsible for, that we can help those restaurant partners that desperately need it, and that we can make sure ultimately that the food is delivered safely to our customers, which is our end goal, really. And I think that's it. So thanks very much for listening to me, and yeah, I'll stop sharing and hand back to Paul.
Thank you. Outstanding, Stephen, and clearly Just Eat's Takeaway is a global leader in food service and delivery, and thank you so much for sharing your insight and some really compelling industry trends with us. I think in the interest of time, I'm going to pass it over to my co-moderator, and then anybody who has questions can just save those to to the end of the second presentation. So if you just give me 1 second to share Michelle's slides. I'm very, very happy to pass the presentation over to Michelle Martin.
Thank you. Thanks, Paul. I'm really excited to introduce Dr. Betty Feng. After earning master's and doctoral degrees in food science from the University of California, Davis, Dr. Feng joined Purdue University in 2018 as an assistant professor of food safety. Betty's research program uses a sociological approach to explore cultural, social, and environmental factors that affect food safety behaviors. Her research identifies barriers to understanding food safety risks in consumer kitchens, develops strategies that empower food handlers to make science-based decisions, and increases food safety knowledge and best practice compliance of both consumers and food handlers. Today, Dr. Feng is going to discuss the results of her study looking at consumer food safety perceptions and handling practices during the pandemic. While COVID-19 has not been shown to be transmitted through food, the pandemic has still changed the way consumers view food and food safety. Sounds like a recipe for a great discussion. Take it away, Dr. Feng.
Hello, I'm Betty Feng, and today I will be happy to share some of our study findings. Understanding how do the public handle food during the pandemic, and what are the things we learned about food safety education during the pandemic and post-pandemic. So before I start my presentation, I want to share like a little bit more. So all of those research I'm presenting today, researcher behind the scene is Marilyn Thomas, one of my PhD students who is graduating in May 2022. And what we conducted during the pandemic were some longitudinal consumer surveys, consumer focus groups, as well as some content analysis in the early pandemic period, trying to understand what are the information about food safety recommendations to amid the virus, amid the disease. So let's start from the longitudinal survey. Starting April 2020, we have been collecting consumer information, understanding how they practice around food, how they perceive the food safety risk, as well as getting COVID from foods. And no one really knows how long this pandemic could be. So we planned for a little bit over 5 months. And then we noticed that no, it's not over. So we continued every other month. So far we collected 9 waves from April 2020 to May 2021. And most of the data I'm presenting today are from the first 5 months, and we're still analyzing the rest of the year's survey results. To better understand our survey results, we also conducted focus groups. The first phase, we recruited participants and we try to facilitate the repeating focus group with the same group of people for over 3 months. Try to understand what are the things have been changed, what are the things that are new to their daily food preparation. And then in the after a year, in 2021, we recruited participants from the May 2021 survey. So we conducted another round of focus group trying to better understand, after a whole year, what are the things that have been changed and why they want to change that way. So the survey topics included preventive measures for food safety as well as COVID-19, people's risk perceptions for getting foodborne illness as well as getting COVID-19. And then we also wanted to understand what are the trusted sources of information of both food safety information and COVID-19 prevention information. So the very first wave of survey, we found that people tend to wash their hands with water only less. So what does that mean? If you look at those bar charts, the left side, lightest green, is what they tell us before pandemic, how they wash their hands, wash their fruit, and use food thermometer. And the middle bar is during the pandemic, what they're currently do. And then the darkest green represents what are their anticipated practices after COVID, after the pandemic. So the very first group presents how do people feel about what's their practice around wash their hands. So apparently they are less likely to wash their hands with water only and more likely to wash their hands with soap during the pandemic. What is also interesting is they anticipate themselves to go back to wash their hands with only water after the pandemic. The same thing with the soap. They anticipate themselves go back to a lot of the behaviors. And what we also found interesting was people start to wash their fruit and vegetables with soap, which was not recommended due to the fact that the soap was not developed for us to intake. So there were a lot of cases people reported they have diarrhea, they have vomiting symptoms after intake those like unwashed soap on those fruit and vegetables. So actually that was not a best practice. However, to be more cautious, people are doing that. During the pandemic and even after the pandemic, they anticipate themselves to continue wash fruit and vegetables with soap. So this is what we found in August, after 5 months, in August 2020. We noticed that people start to don't have as a clear memory of what they are doing before pandemic, but they do anticipate go back to what is more comfortable for them. So we still observe that wash hands with water is significantly higher they anticipated after the pandemic. And also we found that there are more people continue to say that they wash their fruit and vegetable more often than before the pandemic, and they want to keep this practice. And what we also see, A and B here, means there is a significant difference between during the pandemic and after the pandemic. So people still feel like even if there are more chances for me to wash the fruit and vegetables with water, but after the pandemic, it could still be a little bit lower. And similar trends we observed from wash fruit and vegetables with soap. So Another interesting thing we tracked and found that was the use of thermometer and the use of hand sanitizer. So during the pandemic, we noticed that a lot of people are trying to use more of the food thermometer. Like July, in the month of July, significantly more participants used food thermometer than the month of May. And for hand sanitizer, we noticed that there was not significant difference between April, May, and June months, but there was a significant difference starting July. So it seems like July is an important month for a lot of people. They may notice that this could last longer, and also it could be because the hand sanitizer in the early pandemic times was not that available for a lot of consumers. There was a shortage, and as the production keep going, there are more and more available hand sanitizer for people to use to choose. As we continue analyze our longitudinal data, today I will only share 2 of the slides with our 13-month tracking. So what we found was, depending on which population group they came from, their practice could be quite different. So for the younger adults group, so 22 years old to 44 years old, represents this, we use the dark square, represents their hand produce washing with soap practice. So we noticed that those younger adults are significantly more likely to wash their produce, fruit and vegetable, with soap compared with the older adults, 55 years old and older. Another interesting finding we noticed was hand washing. So we noticed that early on in the pandemic, during the pandemic, people live with older adults are more careful. So there's significantly higher percentage of them washing their hands with soap compared to those people who do not live with older adults. However, as the pandemic progresses, unfortunately, we see a decrease. Eventually, there is no significance between those 2 groups. It's not because of people who do not live with older adults wash their hands more with soap. It was because those people who live with older adults decreases their practice, their best practices over time as the pandemic progresses. So what does that tell us? We also conducted the focus group trying to better understand what are the rationales and why people do certain things. So for example, we only list some of the representative quotes from our focus group. When it comes to hand hygiene, very early on in the pandemic, during the early on of the pandemic, our participants tell us that they got a lot of peer pressure. They increased their hand washing best practices using soap, wash for a longer time, because they feel like other people are looking at them. And then for produce washing, because why they're using soap, because in their mind they felt like other people are touching their produce in the supermarket and they're not really sure whether they have COVID or not, and also they're not really sure if the virus can be transferred on the skin of the fruit and vegetable. So to be sure, they want to wash them with soap. And when it comes to thermometer using, it's the same thing. They start thinking about more about how to make sure they are protecting themselves and their family from foodborne pathogen as well as other viruses. Okay, so I also want to show you how we used both the survey and focus group to better inform us what we see and in the data. So this figure shows us that people's hand washing perception, how much they feel like hand washing is important to protect them from which concerns, health concerns. So the green bar shows that people believe that hand washing really protect them from getting COVID. And the green bar shows the percentage of people they believe that how much they believe that they wash their hands to protect themselves from getting foodborne illness. No doubt, what we see over time is consistently people perceive doing those things, those good best practices change, are because they feel like those practices help themselves protect from COVID instead of getting foodborne illness. So one of the focus group representative quote we got was, "The only thing I'm doing, I guess, well, more frequently. I don't know if it's related to food or what. When I come from the supermarket or having packages, I'll wash my hands before I do anything else. I put the food away and then I wash my hands." So it seems like there is a discrepancy of understanding how this hand washing helps not just for protecting them from COVID, but also other illnesses. But that's something, there is a disconnection among the consumers. As for the trusted sources, because this sample was from the United States, so we noticed that constantly people have this, they believe the Food Drug and Drug Administration more for the food safety messages and trust CDC more for the COVID message. There is nothing, there is very consistent with other studies. What is interesting here is they reported the lowest trust was social media influencers. So we try to understand the difference. So because we do notice that there are a lot of people trusting the social media information, but when we really ask the question, who do you trust? The social media influencers were ranked the lowest. That was surprising to us. That could be due to the fact that a lot of the times people wouldn't really perceive the information that their family and friends share with them as information coming from those social media influencers. So you can see they have a significantly higher trust to their family and friends. So they may not even consider what they see on Facebook or on TikTok as something produced by influencers instead of from their family and friends. Another interesting piece that we noticed was no matter it was for food safety information or COVID-19 information, health professionals was well trusted. And they trust health professionals more for COVID information than food safety information. And previous research conducted by my team, it showed that health professionals, even though a lot of people trust them for food safety information, depending on their expertise, they're not necessarily well trained in conveying food safety information. So when it comes to when we try to understand more about the trusted sources from our focus group discussions, we found some very interesting insights. So some of them tell us very different questions, like very different reasons. But we summarize some of those reasons to this theme, which is they trust the credible sources that are backed by science. So no matter what is the delivery format, they just trust information they feel like is represented or came from solid science. So we also wanted to know, we know that there are a lot of information in the early pandemic time on social media, but we don't really know the quality of this information. So back in 2020 June, we conducted a content analysis of YouTube videos that are sharing information, tips about how to protect yourself from COVID, especially when handling foods. Eventually, after we screening over 1,000 videos, we included 85 for this analysis. And we found that a lot of those videos actually have featured health professionals or experts. And a lot of the videos are talking about hand washing procedures. And then we specifically try to look for information that are not suggested by the health organizations. So including washing produce with soap. So 16% of the videos recommended to wash your fruit and vegetables with soap. And then we also found some miscitations. What does that mean? Means that people tell you that these recommendations came from NIH or came from some organizations, but actually this organization never really even said that. For example, one of the miscitation was following the logic, keep groceries on in garage on the porch for 3 days. So they tell people that's recommended by the health organization, but actually it's not. So what are the lessons learned from all of those practices, all of those data? First, we know that indeed, consumers handled food differently during the pandemic. They are so afraid of getting COVID, so they are extra careful when they handle their food. Secondly, we notice that even though they change their behavior, they wash their hands more frequent, or they use their thermometer more often, but there are some cognitive disconnection between the prevention of COVID, coronavirus, and preventing other foodborne pathogens, which is something we don't want to see because we do want people to be cautious when they handle their food, even after the pandemic. And the third is the accuracy of food safety information on social media. So we noticed that social media is a double-bladed arrow, right? A double-bladed sword. So we like it. It's very convenient, and actually consumers really rely on social media nowadays for a lot of information, getting recipes, getting recommendations, how to better store and keep their food safe, fresh. But because it's less regulated, no one really review the content. So there could be a lot of information on the social media have never been have never been regulated and reviewed. So when it comes to the accuracy of this information, especially when it comes to citation of some like science institutions, we need to be more careful with those information. And as we know from the survey and the focus group, people do trust information that shows you that this information is backed up by science. But if those misinformation were miscited, then we will have a trust issue among our consumers. With that, I want to thank you for your attention. And those are our social media and website. Feel free to ask us questions on social media and we will get back to you. And those are our related publications that reported the data that I just presented. And I want to give our acknowledgement to USDA, NEPA, and Purdue College of Agriculture who funded the projects. Thank you very much.
Thank you so much, Dr. Fang. That was excellent. I really enjoyed that. As a person who's done a fair bit of food handler training, I really love the research that you were able to present today. So at this time, I'd like to invite Stephen back. And just a reminder to everyone, if you have questions that you would like to ask our speakers today, please put them in the chat box. I actually see that Paul has one for Stephen. And Paul, if you're okay, I'll read it out for you. Stephen, what has been your experience with ghost kitchens as it relates to any differences in food safety practices or risk compared to traditional food service partners?
Yeah, thank you for the question. And it's a really relevant one right now, actually, because we're seeing the number of ghost kitchens or dark kitchens, as they're called in various different places, go through the roof. Really, there are a lot of them. There's a lot of interest in them, and we have to answer the question. Really, we've really tackled this in two separate ways. One is that we start off in most of the countries in which we operate from a position of prohibition, really, where we say, listen, that this is not what we do. We don't necessarily want to engage with ghost kitchens because it's it's somewhat disingenuous. The customer thinks that they're getting it from a restaurant on Main Street, and they're not. So that's our sort of default position. However, we do have a lot of market pressure and a lot of commercial pressure to let them on board. So where we have, and I'll point to the UK here, where we've got a significant amount of dark kitchens, we have thankfully been able to, my team's been able to put in minimum sign-up standards that sit somewhere above the general sign-up standards for restaurant partners, so that we're in this position of having a piece of the estate that in that country at least that's actually operating to a higher hygiene standard than the standard restaurant partner offer. But yeah, it's a bit of a fudge of an answer. But our position is really it's a balance between the customer expectation of these places and the sort of commercial pressure to get it on. But in order to do that, we've imposed those higher minimum standards.
Thank you. I do have a question for Dr. Fang, but I'm going to keep you in the hot seat a little bit longer, Stephen, before I see you mute yourself. Not quite free yet. But question from Jeff. What are the major things that keep you up at night in terms of food safety? Love that question.
It's a really good question. Yeah, I can probably answer this with one word, which is allergens. We have various different pieces of legislation, obviously, that dictate what we do with allergen information. But it's the one thing we know. We're all, food safety professionals. We know the risks that come with pathogenic bacteria, with any other type of contamination. But allergens is the one where we really can't have a margin of error. That there is no safe space when we're talking about people who have, extreme nut allergies, or any other allergy that may affect them. So one piece of missing information in one of those 100-odd million orders that we are carrying out that goes to the wrong person, and all of a sudden we've got an incident that may unfortunately be a fatal one. So yeah, allergens is it really for me.
Thank you. Dr. Feng, when I was listening to you speak, I was thinking about, after your research, what's one thing that you would like to see food handler training programs adopt? Is there any messaging after the pandemic? One thing, I mean, you mentioned the washing the produce with soap, and that certainly resonated. Just curious what your thoughts are about that, something that you want them to focus on.
Thank you. So I was also reading the chat from Tim. So I was thinking what are some wish list from me and from my team? Hand washing is definitely one of them. Hand washing, but with correct practices, right? Wash hands with soap. And that would be one I think is very, very important. And also during the pandemic is so applicable because the information is out there. The sad thing, or the item that really made me worry, was people are getting away from it. They feel like, okay, we are going to live with the virus for the rest of my life probably, and I will go back to my old practice, just wash my hands, just rinse it under water without soap. So that's not very good with any of our public health professionals. I think that's something, it's a lower hanging fruit. Continue enhancing hand washing best practices. The second thing I really want to see would be how we can really convey information consistently. Wash fruit and produce. Why it's very interesting is it was not recommended by FDA, CDC, or any health organizations, but it's out there and people believe it. So and if you see our content analysis, there are quite some videos trying to push this forward, and we saw videos that featured doctors or other health professionals telling people wash your produce with soap, with dish soap. And some even recommend using dishwasher to wash your produce. So all of those, now when we look back, it's a laughter. But at that moment, people, while they're in a panic, they really believe it. They really believe all of those information came from, they thought, science-based or science background people. So how we can be consistently pushing information and also providing science data to back our message up would be something I'm really, really interested in. Take efforts to collaborate and work with more educators on.
That is great. And I know that Dr. Sly had mentioned maybe repeating the questionnaire in another year and a half, and that would be interesting. That's great. Another question for you, this one from Ophelia. What is your take on the quality of risk communication as it relates to the public's understanding of food safety versus COVID safety?
Thank you. Thank you, Ophelia. So this is a question sticked in our mind for quite some time, even before we developed this this survey, because early on of the pandemic, I received some questions from the public, from like interview, like from like those television anchors, including like we believe like this virus, coronavirus, came from like a food source, right? Came from wildlife, and then like people like somehow made those wildlife as food, and then it's from and then like some other cases saying that they exported some frozen fish, and then that came contaminated, and then like made people sick, and then there was another outbreak. So there were a lot of those news out there talking about, implying, although they are not going to tell you that indeed those came from food, but though they imply those are food sources. That really bothers us. And until now, we would say that the more we communicate clearly without a lot of implications, implying those messages, redirect those news to food safety or food concerns, it would help a lot of consumers to rebuild their trust in our food system. And also, frankly speaking, for a public, as a food scientist, food safety professionals, we know that foodborne pathogens and coronavirus, they are two things. We are doing completely different research on those two topics. But to a general public, they feel like you guys are all scientists and you all work with those microbes. So you should know they are the same. To them, they are the same. Both of them, you cannot see them, you cannot touch them, and they're afraid of them. So I think it is very important first to communicate clearly, try to differentiate, tell them the differences. Second is, I think, give them a little bit more examples, help them to understand. To us, we know the difference between virus and bacteria. To them, they are also the same. A lot of the times, I think we are so stuck in our own communication silo. Around us are all health professionals, scientists. We use our language, but we forgot when we communicate with our grandma, with our parents, who are not public health professionals. They may not even use those terminologies. So forget about the jargons. Let's just speak like our people around us. Yeah.
That is great. Thank you. And actually, there's another question here for you, Stephen, and this is again from Jeffrey Farber. What type of action would you take, if any, if one of your restaurant customers gets a bad rating on a government inspection?
So if one of the restaurants receives a bad rating, again, it varies depending on where we are. So we've, as you would expect, we've got a global food safety policy, but it's somewhat vague because of the different jurisdictions in which we operate in. I'll give a good example of what we would do, and from that you can probably deduce some of the bad examples of what we would do, which would be nothing. But again, looking at, well, I've used the UK a couple of times, but I'll use a different one. In Denmark, for example, where we operate quite a similar system, we have nationally published food hygiene ratings, and as a result, we can take that data and put it directly onto our platforms, which we do. So a customer going onto that platform can see the food hygiene rating for the restaurant that they're going to order food from. Because we are able to be so visible there, we operate a minimum sign-up standard, and that exists both for new sign-ups but also existing restaurants. So if they receive a poor food hygiene score, or alternatively, if they receive a justifiable complaint, or they're cited as part of a food poisoning outbreak, then put bluntly, we offline them. The immediate response is they're taken off the platform. The secondary response is that we support them. So we do utilise our partnership with NSF to have professionals go in there to give them guidance, re-rating support, whatever it takes to get them back on. And all of that, I should say, is done free of charge to the restaurant, because it's in our interest to get them back online. But with that would be the standard good example of a food hygiene response. There's obviously influence from our comms teams and our management teams about reputation. And as a result, regardless if they fulfill that route, if there is too much risk for us as a company to be associated with a specific restaurant that may be part of a food poisoning scare, or any other legal issue, then we'll play it safe and keep them offline. But that's the good example. There are other countries, being brutally honest, where we don't have that same level of response, but the support part is still there, and the offlining when it gets serious is still there, but it's not as automatic.
Thank you for that. I think we have time for just one more. I will, Stephen, direct you. There is a great comment from Dr. Sly in the chat box for you. This is a question for you, Betty. Would you look at other things like washing meats prior to cooking and food safety concerns? Will you include these other factors like ethnicity, social, economic level, gender, and so on in your next study?
Thank you. So let me first address the first question. So washing meat prior to cooking has been one of the challenge, and in our other studies, like we have been like focusing on that. For example, we develop like virtual food safety education materials, just trying to target washing meats prior cooking. And we do notice that sometimes we can only like target at 1 or 2 or 3 at most messages when we're trying to communicate. When it comes to COVID pandemic, like it has not been as of a specific challenge. So that's why we did not include that in this like COVID like related study. The second question about like other factors, yes, those are quite important, and that's one of the items we're analyzing the data, trying to get more insights on when we communicate with them. Depending on who we communicate, we should communicate in different either topics or different ways. Sometimes we recently just submitted a paper trying to like develop a curriculum just for low-income families. During the pandemic, we conducted some virtual food safety programming with those target audiences. So yeah, I definitely look into, and I look forward to more collaborations. If anyone, including Maria, if you're interested, please let me know, and I will be happy to see how we can collaborate on that. Thank you.
That's great. Thank you. Thank you so much to both yourself, Betty, and to Stephen Glass for this great discourse, the presentations, and to everyone for attending today's webinar, Takeaways from Takeout, How We Interact with Food Post-COVID-19. I've really appreciated the conversation, and I admit I'm going to definitely take this back to my own dinner table tonight and have some great discussion. If there are any further questions, I am going to put our illustrious chair's email in the chat box, Susan Sabatini, and you can email them to her and we'll try to get to them after the show, as it were. And with that, Susan, thank you for your unfailing support for our whole committee, and to Sumitra Meaden from CFIA for hosting today's webinar. Please join us next and last session on November 24th, where the topic will be What Your Recipe Book Forgot to Mention, a special food safety in the home Q&A. That day, we're going to have an expert panel made up of the already fabulous Dr. Feng, Jim Chan, who is no stranger to the GFSS and is a former manager of food safety with Toronto Public Health. Our very own Larry Goodrich from the University of Guelph, as well as Chef Wayne Nichols from Compass Group Canada. You can have your voice heard and submit questions ahead of time by emailing Susan at the address I will provide. On behalf of the Guelph Food Safety Seminars Organizing Committee, thank you for joining us today. Have a great rest of your day, and we will cook up some more magic next Wednesday, November 24th.